Hello everyone, my name is Apshita Menon and I am a PhD candidate at Mercer University College of Pharmacy, and I would be explaining my poster, Dissolving Microneedle Embedded with Microparticles, a novel pain-free vaccine for respiratory syncytial virus. Before I explain my poster, I would like to say how the COVID pandemic has affected me. As a member of the Vaccine Nanotechnology Lab, I realized the importance of educating people about vaccines. I took it as my responsibility to educate as many number of people as possible about how vaccines work and how vaccines are one of the only way to protect yourself and your families against the COVID pandemic. Now, going back to my poster, RSV is an infectious disease that affects children under the age of 5. There is no vaccine available for RSV as of today. In my lab, we are trying to develop a novel vaccine delivery approach for RSV. In this poster, we formulated uh, polymeric microparticles encapsulated with F protein virus-like particle, and we formulated this using PLGA and high pressure homogenization as the formulation technique. Once we optimized the formulation using design of experiment, we formulated the dissolving microneedles using hyaluronic acid. Once the formulation of hyaluronic acid microneedles was completed, we characterized the microparticles and the microneedles. We looked at antigen integrity of the FELP post-formulation as well as after storage for 8 months at 4 degrees Celsius and observed that the FELP was stable after storage. We looked at uptake of the antigen using fluorescence microscopy and observed that the particles were taken up by the dendritic cells within 3 hours. We characterized the microneedles using scanning electron microscopy and observed that the microneedles were around 400 microns in length and dissolved within 5 minutes in murine skin. We confirmed the presence of micropores and confirmed the presence of micropores on the murine skin using methylene blue and H&E staining. Once a formulation and optimized characterization was done, we went ahead with the in vitro assessment of the microparticles. We observed that our microparticles, with and without the adjuvant monophospholipid A, was able to stimulate stimulate nitric oxide, which is the body's first line of defense, as well as was able to stimulate the formation of autophagosomes. Autophagosomes are part of autophagy, which is a connecting link between antigen presentation. We also looked at the ability of our microparticles to express the antigen presenting molecules and observed that our formulation was able to upregulate the major histocompatibility complex 1 in the dendritic cells, and which may further help in generation of a cytotoxic T cell response in further studies. Then after this, we further went ahead with the in vivo studies in which we gave 1 prime and 1 booster dose at 3-week interval, and we collected the blood intermittently. The serum was tested for the antigen-specific antibodies using antigen-specific ELISA, and we observed significantly high levels of total IgG and IgG subtypes in the serum. We looked at the lung homogenates antibodies as well. The mice during immunization were challenged with live RSV virus, and the lungs were collected after sacrifice of the mice 1 week later. The lung homogenates also had significantly high levels of IgG and IgG subtypes, and we also observed high levels of IgA, which is a marker of mucosal immunity in the lungs. Thus, I would like to conclude that in the absence of a licensed vaccine for RSV, our approach of microparticle embedded microneedle vaccine is indeed a viable candidate for a vaccine for RSV, and as microneedles are essentially a pain-free method of vaccine administration, it would be a very desirable approach or strategy to for a vaccine for children as well as adults. Thank you.